Just about everywhere I go, I'm asked, why on earth is a man of your age in your 66th year from Scotland walking across Zambia? It's an honest question, actually, and it deserves an answer. It's nothing about walking, actually. It's not even about keeping fit, but it is about health. It's about sanitation. That's a subject that most of us never really consider, but it is so important. It forms the foundation for health.
I'm Chris Folden, a retired public health nurse consultant, and through my career, I've been passionate about one very simple principle: get the basics of healthcare right: clean water, good sanitation, and prevent an infection before it starts. More than 10 years ago, I helped establish the Logie legacy, supporting the long-standing partnership between NHS Borders in Scotland and St Francis Hospital in eastern Zambia. St Francis is now a major rural referral hospital serving hundreds of patients and a large community of staff, students and families. But its sanitation infrastructure has not kept pace with the growth of the hospital, and that matters, because a hospital should be a place where people go to get better, not somewhere where poor wastewater management can contribute to the spread of infection. And that brings me to a man who lived almost 200 years ago, Joseph Bazalgette. In 19th century London, cholera and other diseases were devastating communities. Bazalgette understood something that seemed obvious to us now: dealing properly with human waste is a public health intervention. His work on London's sewer network transformed the city's sanitation, and his name inspired ours: Zambaz. Zam for Zambia, Baz for Bazalgette. The Zambaz project aims to raise £200,000 to provide St Francis Hospital with a modern, sustainable wastewater treatment system. And I decided I would try to raise 50,000 of that, exactly a quarter of the project cost. But rather than sit at home asking people to support it, I thought I'd walk. 16th of July, I stood at Victoria Falls and started walking towards the Malawi border, 1,100 kilometers. We called it Zambia Route at 66. Walking, roads, villages. And then something happened that I hadn't really anticipated. The walk became about much more than the walk. I've met people whose lives are very different from mine. I've been welcomed into Zambian homes. I've walked alongside people I've only just met. I've seen extraordinary kindness. I've seen hardship. I've seen children carrying burdens that no child should have to carry. And I've learned that when you slow down enough to walk through a country, you begin to see it very differently. And that's why this project matters to me. Because behind every statistic is a person, a patient, a mother, a child, a nurse, a student, a family. Safe water and safe sanitation aren't luxuries. They're part of the foundations of good health.
Well, that's it. That's the story. 1,100 kilometers across Zambia. Every step is building something bigger. It's helping to protect a hospital, its staff, its patients, the hundreds of people that use it every day, from disease, infection. If you're new to this, where have you been? Well, welcome. Why don't you join me for the rest of the journey, and let's discover even more things that are lying ahead.